Republicans say they're not giving up on their plan to repeal and replace Obamacare, even though they couldn't secure enough votes on their replacement bill in the House. Part of the American Health Care Act would have stopped federal Medicaid payments to Planned Parenthood for 1 year. But a Kaiser Health tracking poll found that most Americans think this funding should continue. Dawn Laguens is the executive vice president of Planned Parenthood Federation of America, and she joins me now from Washington. Dawn, thanks for being with us.
Hi, Elaine.
So can you start off by explaining, first of all, what this funding pays for?
Yes, well, I always like to start off and remind folks that Planned Parenthood is not a line item in the federal budget. We don't get a Publishers Clearinghouse check. We get reimbursed for providing preventive health services to millions of women in this country. That's STI testing and treatment, cancer screenings, birth control, and federal funds aren't actually used for abortion.
Well, so since so many Americans, as we saw in that Kaiser poll, appear to be against blocking this funding, do you think that Republicans will keep Planned Parenthood out of a new bill if they propose one?
Well, I think if they want to have any hope of really passing a bill, they certainly would not put Planned Parenthood in there. The combination of attacking Planned Parenthood, kicking millions of people out of health insurance, attacking maternity care, those were things that made that bill unpopular with over 80% of the American public. So I would think they would learn from that, but as you know, they have gone after Planned Parenthood for years, so we're going to be prepared.
And how will you say you'll be prepared? What does that mean exactly?
Well, today, I don't know if you noticed, it was Pink Out the Internet Day, and millions of people stood up once again, as they have for months and months, and said, we're not going to sit by while our healthcare system is dismantled and while Planned Parenthood is attacked. And so what we believe is that just like in the last recess, we are going to see millions of people heading out to their Congress members' offices and rallies and town halls and letting them know what they expect them to stand up for. And Planned Parenthood is one of those things where across this country, almost every community, 1 in 5 women has been to Planned Parenthood.
Well, unlike some other federally funded agencies or programs, your organization can fundraise. What would happen if Planned Parenthood did lose this funding? You talk about your social media campaign, for instance. What other avenues would there be for Planned Parenthood?
Well, Planned Parenthood already, you know, the federal health care system and Medicaid reimbursement in many places is very low and doesn't even cover the cost of care. So already donations that our health centers and affiliates get often subsidize care for others. But we would certainly do everything we can, as Planned Parenthood has always done, to keep our doors open, to keep people getting this critical and life-saving, in many cases, care. But we can't be expected to be the federal government and replace care for millions of people through donations, and shouldn't have to. This is care that Americans deserve, and as you saw in that poll and many others, the American public is firmly behind Planned Parenthood.
All right, Dawn Laguens from Planned Parenthood, thank you so much for your time, Dawn.
Thank you.